How do exotic vets use advanced diagnostic imaging? Imagine trying to figure out what's wrong inside a tiny bird's skull or a reptile's spine without opening them up. That's where advanced diagnostic imaging comes into play for exotic animal veterinarians. These specialists use high-tech tools to see inside animals that are often too small or delicate for traditional examination. It's like having a superpower that reveals hidden health issues. One of the main tools they use is computed tomography, or CT scans. These produce detailed cross-sectional images of the animal's bones, organs, and soft tissues. For example, if a turtle has a suspected skull fracture or a snake might have spinal issues, a CT scan can give a clear picture of the problem. These scans are high-resolution and can show tiny fractures or tumors that might not show up on regular X-rays. The process usually takes about 10 to 20 minutes, and animals often need sedation to stay still. The cost varies but generally ranges from $500 to $2,000, depending on the size and complexity. Magnetic resonance imaging, or MRI, is another advanced tool. It uses magnetic fields and radio waves to create very detailed images of soft tissues. This is especially helpful for diagnosing neurological problems in birds or reptiles. For example, if a bird shows signs of paralysis, an MRI can reveal issues with the brain or spinal cord. The procedure takes about 30 minutes to an hour and also requires sedation. MRIs are more expensive, often costing between $1,500 and $3,000, but they provide unmatched detail for soft tissue injuries or diseases. Positron emission tomography, or PET scans, are used less often but are very useful for detecting metabolic activity. They can help identify cancer or inflammation by tracking radioactive tracers. For example, in small mammals like hamsters or guinea pigs, PET scans can spot early signs of tumors or infections that are hard to detect with other methods. The process involves injecting a small amount of radioactive material and then imaging the animal's body, which takes about 30 to 60 minutes. Nuclear medicine techniques like scintigraphy involve injecting radioactive substances to evaluate organ function. For instance, in guinea pigs, scintigraphy can help diagnose hyperthyroidism, a common issue. The animal is injected with a radioactive tracer, and images are taken to see how the organs are working. This method can reveal abnormalities in organ activity or structure. Thermography is a non-invasive way to detect heat patterns on the animal's surface. It's useful for early detection of infections or inflammation. For example, if a raccoon shows signs of rabies, thermography can help identify areas of abnormal heat that indicate inflammation or nerve issues. It's quick and doesn't require sedation, making it a good screening tool. Veterinary professionals working with exotic animals need special training to operate these imaging machines and interpret the results accurately. They often work closely with specialists in veterinary radiology or neurology. Handling these animals during imaging requires gentle restraint and sometimes sedation or anesthesia to keep them still and safe. Advanced imaging helps vets diagnose fractures, tumors, neurological disorders, and organ problems more precisely. It guides surgical planning and helps monitor how well treatments are working. For exotic animals, these tools are essential because their small size and unique anatomy make traditional exams difficult. Using these technologies, exotic vets can provide better care and improve health outcomes for animals that often require very specialized attention.